Here in the East Midlands, I think we're quite lucky to have a dedicated inpatient unit that serves the whole region for the treatment of anorexia nervosa. The treatment we offer is provided by a dedicated, professional and highly motivated team and provides the care necessary to get better from an eating disorder. This involves good quality nursing care, good medical care, occupational therapy input, an intensive group programme which has various layers to it, from high profile psychological group input run along various therapy techniques such as CBT or mindfulness, and also individual input in that most of our inpatients also have individual psychotherapy as well as the group programme. And I think providing this treatment in a facility, in an environment in which there are others which suffer with the same problems, provides an additional level of support. And I think the camaraderie of people trying to help each other move on from a severe eating disorder allows people to know they're not alone in suffering with this. And I think that does help people move forwards.
Qualified nurses are involved with patients on admission, where they're allocated as a name nurse, and they work very closely with patients throughout their admission. Nursing staff work with patients on a one-to-one basis. We see them at regular intervals throughout the week. This gives patients opportunity to explore what's surrounding their illness and what's driving their illness. And we review care regularly to ensure that people are progressing in their recovery.
So one of the main parts of our role would be to support patients through the process of starting to normalise their eating habits again, which can be very difficult and distressing and takes a lot of care and attention. As healthcare support workers, our role would be to really get to know a patient, spend lots of time communicating with them, and we are their listening ear really. We spend lots of time with their families, lots of time with their close friends, and try and make sure that their care needs are met. It's a real privilege seeing somebody come into hospital and then integrate back into their home and family life again, and that's what motivates us and keeps us going.
Hello, my name's Rachel. I'm one of 3 occupational therapists that will be working with you to help support you in your treatment on the ward. We also provide a day programme which has lots of group work available in the form of educational, creative or psychological groups. We have a large craft area available with lots of resources to get involved in any craft activities you like. Some examples include decoupage, jewellery making and pottery.
Our sort of general philosophy and outlook with respect to managing medical and mental health problems with patients on the ward is to try and work collaboratively with patients. And in order to do that, we will offer advice to patients. We provide some written materials for patients, and our general idea is to allow people to have enough information so they can make informed decisions about their treatment. But the key point is we try to work collaboratively with patients. In the overall management of patients, we understand that patients have mixed feelings about recovery, and we try to be understanding and compassionate about that in our dealings with patients.